Introduction to Origin and Development of Chinese and Western Medicine and Their Academic Characteristics. Contents. 1. The origin and development of Chinese and Western medicine are different in academic characteristics. 2. Introduction to the origin and development of Western medicine and its academic characteristics. 3. Brief introduction and academic characteristics of the origin and development of Chinese medicine. Part 1. The origin and development of Chinese and Western medicine are different in academic characteristics. The historical origins, development, philosophical basis, cognitive paths, and behavior rules of Chinese and Western medicine are different, forming complete systems respectively. The development trajectory of each medicine is different, and each has its own national brand. The holistic worldview is one of the cornerstones of Chinese medicine, and the humanities are integrated with the sciences to form a cohesive whole. 2. Introduction to the origin and development of Western medicine and its academic characteristics. Western traditional medicine is divided into 3 main stages. The Hippocratic stage in ancient Greece, the ancient Roman Galenic medicine, and Arab medicine, also known as the medieval medical lighthouse. Hippocrates and Galen in Greece and Rome, respectively, once understood medicine according to a holistic view. Later, Western modern medicine abandoned this view in favor of the worldview of scientific modernity. This began during the Renaissance with the development of the European natural sciences, with the rediscovery of the philosophy of Plato, and the victory of Catholic philosophy and thought of the universe. Later, with the ascent of modern science, chemistry, and physics, the holistic view of medicine was completely lost. Modern Western experimental medicine. In the 16th century, Vesalius established the school of anatomy and physiology by defining the structures of the body. William Harvey used experimental methods to prove the blood circulation of the human body. In the 18th century, Morgagni established pathological anatomy. These great discoveries of anatomy, physiology, and pathology laid the foundation of modern Western experimental medicine. In the 17th century, Western medicine emerged as 3 distinct schools of physical medicine, chemical medicine, and vitality medicine. The school of physical medicine was based on the principle of mechanics, and this was used to explain the physiology and pathology of the human body. It used methods of observational testing and quantitative analysis. Major representatives were Borelli and Bellini. The School of Chemical Medicine. This school believed that all life activities could be explained through chemical reactions. Its major representatives were Sylvius and Mayo. The Vitality Medical School believed that the body had an inherent vitality and that it served as a tool of the soul. The Vigor School attempted to challenge the simple explanation of life in the schools of physics and chemical medicine. Their experimental observations of stimulation, mechanical stress, and excitability led to the emergence of modern physiology and neuropathology. Major representatives of this school included Stahl. From the end of the 19th century to the beginning of the 20th century, the united camp composed of the schools of physical and chemical medicine gradually gained an advantage in the competition with the Vitality School and formed the mainstream of Western medical thought. Microanalysis methods, logical thinking models, and so on have all become the conceptual basis of modern Western medicine. Representatives of modern medicine in the 20th century include Wheel in the School of Modern Cytology, Koh of Germany in the School of Bacteriology, the School of Physical Diagnostics and X-ray, Banting in the School of Animal Insulin, and Fleming in the School of Antibiotic Penicillin. Just a few minutes, we've walked through the 414-year history of the establishment of modern Western medicine. From the development of anatomical physiology in 1514, with Vesalius in Italy, to the introduction of the Fleming antibiotic penicillin in 1928. From the above historical overview, you can see that at the beginning, both Chinese and Western medicine had a common understanding of the holistic nature of the human body, but that in modern times in the West, because of the rise of modern science, Western medicine began to veer increasingly toward localization. Western medicine is a kind of medicine based on reality. It pays attention to details. It acquires knowledge from analysis, reduction, and minute observations. Since the development of autopsy, it has been possible to see inside the human body. This and the microscope have made it possible to observe organisms at the cellular level, which has led to leaps and bounds in the fields of microbiology. This has taken the world from yellow amines to antibiotics, and all the way to hormone therapy. Part 3. A brief introduction and academic characteristics of the origin and development of Chinese medicine. TCM originated in China and has a history of more than 3,000 years. TCM has gone through a long process of development, from the accumulation of pure medical experience and then formed a system through theoretical summaries of practical knowledge. After continuous enrichment and improvement, different historical stages have shown diverse developments, contents, and characteristics. From the Warring States to the Han Dynasty, through the accumulation and improvement of medical experience, TCM formed an academic system based on the 4 classic works of the Internal Classic, also known as Neijing, 81 Difficulties, 81 Nanjing, the Pharmacopoeia of Herbs, Bancao Jing, and the Classic of Assorted Diseases of Cold Damage, Shanghan Zabing Lun. The content contained in the 4 classics, including medical principles, methods, prescriptions, and pharmacology, represent the establishment of TCM as a comprehensive system. For example, the basic theories, diagnostic methods, differentiation principles, treatment rules, drug theory, formula theory, and preventative thinking of TCM are clearly and concretely discussed in the 4 classics. In particular, the treatise on febrile and miscellaneous diseases has applied the principles, methods, prescriptions, and medicines of Chinese medicine to clinical practice, giving a complete demonstration of syndrome analysis. While the 4 classics established TCM theory, they also established the academic paradigm of TCM. In the subsequent historical process, TCM has been continuously evolving within this basic academic framework. Since the establishment of the TCM technical system in the Han Dynasty, it has continuously developed and evolved in the same trajectory. This traditional academic paradigm continued to the Ming and Qing dynasties. To be precise, when the theory of febrile diseases appeared, It had reached a high degree of maturity. All aspects of the system have been brought into full play according to the requirements of the traditional paradigm. After the doctrine of the febrile diseases, TCM had few new works which majorly impacted its theoretical development. TCM has a complete academic system of principles, methods, prescriptions, and pharmacology. This system has distinct differences when compared to Western medicine. This shows that the technological system of TCM has its own unique characteristics. Only by knowing the essence of these characteristics can we learn, understand, and master the application of this academic system more accurately. Any mature academic system has its own conceptual system, theoretical system, and technical operating system. The overall concept beyond structure. The holistic concept is an important conceptual aspect of TCM. It refers to the fact that Chinese medicine understands the human body as an indivisible whole. Therefore, the occurrence, diagnosis, and treatment of diseases must be based on the whole and start from the whole. The holistic view of TCM not only regards the human body as an organic whole, but also recognizes the interconnectedness of humanity and nature, body and mind, and man and society. Therefore, when analyzing and understanding human life phenomena and diagnosing diseases, it is often necessary to grasp this broad interconnection. It's worth emphasizing that only recognizing the content of the overall concept of TCM is not enough. It is also necessary to recognize the unique characteristics of the overall concept. So, what are the unique characteristics of the overall concept of traditional Chinese medicine? First, this holistic concept holds that all things in nature are connected to human beings, and that all things are formed by the qi energy of the unity of nature, which is the universal and transcendental structure of reality. Therefore, understanding the whole does not consider the structure, nor does it need to explore the structure. From this, we can understand why learning the theories of TCM can be different from learning Western medicine, which requires anatomy as the basis for entry. Second, the movement of qi is continuous rather than discontinuous. From the perspective of the process, the whole of such continuous qi movement cannot be intercepted and understood as an individuated phenomenon. Individual segments should obey the whole and cannot exist independently. Therefore, regardless of the understanding of physiological phenomena or pathological phenomena, we should start from the entirety of the life process of a human being, and we cannot realize the whole by understanding its parts. That is to say, the integration of parts of inanimate autopsy do not give us an understanding of the entire living person. Third, as the foundation of all things, qi infinitely fills the universe. Because it's infinite, it's impossible to analyze in a reductive format. To understand life and disease, we must consider various internal and external connections. Otherwise, the cause and nature of the phenomena of life and disease cannot be thoroughly explained. Therefore, the understanding of any life and disease phenomenon in TCM must be explained from the perspective of the whole, the infinite inside and outside. Thus, the model of Chinese medicine is nature, society, psychology, and physiology, a combination of nature and the humanities. TCM pays attention to the whole, not the part. TCM skips and transcends the path of anatomy, establishing another class of functional theory, forming an understanding of the overall process of disease occurrence and development with a unique perspective. For example, a patient came to discuss her symptoms. She was easily annoyed, prone to anger, presented a stringy pulse, red tongue tip, dry eyes, and irregular menstruation. This is an obvious feature of liver depression, but when she was tested in a Western medicine clinic, her liver function was normal and no treatment was suggested. From a Chinese medicine perspective, her problem is real and can be treated with xiaoyao powder. If she were to develop further symptoms, such as a bitter taste in her mouth and a dry throat, it would be possible to prescribe Longdan Xiagan decoction. But in the case of the above example, the liver function test was still normal. 2. Conforming to the natural concept of time. The premise of conformity with nature is predicated on harmony and unity with the natural world. This may be seen within practices such as health preservation according to the changes of the 4 seasons. Conforming with nature is the means by which to achieve the goal of becoming unified with the cycles of transformation of the natural world. Chinese medicine holds that humanity is a microcosmic expression of the world and the universe. The immune system can only be normal if a person accords with the laws of their natural surroundings. Nowadays, young people often go to bed at 1 or 2 in the morning. If the body clock is disrupted, the immune system will be low and they'll be more prone to illness. Practical concepts of clinical value. From the beginning to present, TCM has always implemented the ideological principle of clinical verification. It's manifested in many aspects. First, in the history of TCM, there were famous doctors who specialized in clinical practice, who are named in the history books, but few scholars who purely studied physiology, pathology, etiology, and pharmacology. Because these theoretical models could not treat diseases directly, they weren't advocated and they weren't valued. Second, in the history of the development of TCM, there were no independent basic research disciplines such as physiology, pathology, etiology, and pharmacology. The theories of TCM are close to clinical problems, and they're directly related to clinical problems. Once the etiology and physiology are separated from clinics, they become meaningless. Third, in the history of the development of TCM, medical treatment and medical drugs have always been combined, and pure pharmacy has never been independent. According to general principles, although medicine is designed to treat diseases, it should be independently studied because it has independent research objectives. However, in the traditional system of Chinese medicine, people who do not understand medicine cannot study pharmacy. Almost every pharmaceutical book in history was written by a clinical doctor. Because the TCM and medical theories are completely integrated, it's impossible to establish the theoretical constructs of a drug's nature, taste, meridian, function, and indications if it's not aimed at clinical diseases. Therefore, TCM physicians are also TCM pharmacists who need to treat each person and use prescriptions. After diagnosis by Western medicine, as long as you're familiar with the efficacy of the medicine produced by the pharmaceutical factory, you can take it to the patient. The TCM doctor also has to undertake the preliminary work of the pharmaceutical factory's development. It's not for 10,000 people, and it varies from person to person. It can be seen that TCM has a much larger workload than Western medicine, and it has multiple functions of disease diagnosis, drug development, treatment, recovery, and it integrates the concept of the family doctor, pharmaceutical research and development, and pharmacists. That is why the average income of a TCM doctor in Korea is much higher than that of a Western medicine doctor. In that country, only after graduating from Western medicine can you go on to learn TCM. The theoretical system of TCM is the core content of the technical system of TCM. It reflects and describes physiology, pathology, etiology, pathogenesis, diagnosis, treatment, and pharmacological phenomena, and laws in a unique fashion. The main contents include the theory of yin and yang and the 5 elements, the theory of viscera and meridian, the theory of qi and blood, body fluid and spirit, the theory of etiology and pathogenesis, and the theory of prevention, health and treatment, prescription and pharmacology. It is worth emphasizing that these basic contents of the theoretical system of TCM, when reflecting objectives and its laws, both basic concepts and basic principles all show distinctive characteristics. Morphological structure beyond empirical. This is the most prominent feature of the theoretical system of TCM and the difficulty of learning. Learning and understanding the basic theories of TCM are different from studying Western medicine. One cannot simply directly investigate the empirical basis of the form and structure of the affected contents of the inner body, whether it's the 5 elements, yin and yang, the viscera and meridians, essence, qi, blood, body fluid, or the cause and pathogenesis, result of food products on the meridian system, the emperor and the minister. One must use these diagnostic concepts to find the basis for the explanation from the empirical form and structure of an illness. Yin and Yang and the 5 elements originally belonged to the category of ordinary philosophy, and its connotation could not be limited to the special objectives of medicine. Although the viscera has a corresponding organ in its name, the functional meaning of the viscera given by TCM theory is far away from the Western medicine anatomical concept. As for meridians, this is a concept unique to TCM. Qi is the most important concept of life matter in TCM. It has infinite transformative capabilities and can be used to explain various phenomena in life. However, it is indeed invisible and intangible. Although it is ubiquitous, it cannot be empirically revealed and measured. Although blood and body fluid are referred to as physical objects, their functional significance is difficult to accurately locate on a physical level. As for essence, although its role is very important, it cannot be determined according to a specific measure. The 6 evils in etiology, although being actual reference in the theoretical explanation, empirical research in the medical sense cannot be carried out on their physical nature. Regardless of their significance, the 6 odors and the emperor and ministers of pharmacology are difficult to verify on a material level. Regarding treatment principles such as strengthening the body and eliminating evils, and the practice of adjusting yin and yang, this comes from application on the conceptual basis, and although having genuine clinical outcomes, it cannot be verified according to any tangible material which may present itself to the senses. For example, the definition of acupoints in the Ling Shu 9 Needles and 12 Originals chapter goes, at each intersection of the body, there are 365 meetings. This refers to places where qi and spirit collect and come and go, not the skin, flesh, muscles, and bones. It's obvious that this is a definition of acupoints. The Ling Shu Xiao Zhenjie chapter says, at each intersection of the body, there are 365 meetings which are connected by the collaterals into the joints. Joints here refers to junctions, joint gaps, while meeting refers to where blood and qi converge. This is what an acupoint is. It means that acupoints are not the organic structure of the skin, muscles, and bones under a scalpel, but the functional position of the living body in a state of life. The organic interaction of physiology and pathology. In the theoretical system of TCM, it is not advocated to distinguish between independent physiology and pathology. In its basic theory, whether it is the theory of yin and yang and the 5 elements or the theory of viscera and meridian, it's not only the physiology of TCM, but also the pathology of TCM. Compared with Western medicine, its unique characteristics are extremely distinctive. For the Western medical system, physiology must be studied before pathology can be studied. Pathology cannot be studied without understanding physiology. In the theoretical system of TCM, physiology does not separate from pathology. It exists independently. Therefore, it's difficult to conduct independent research on the physiology of TCM alone. In addition, the physiology of TCM seems to exist to explain pathology. All viscera, meridians, and qi The normal functions of the life organs and life substances, such as blood, body fluid, essence, and so on, can show meaning only when they function abnormally. After studying, people can come to realize that the physiology of TCM is derived from pathological phenomena, which is in line with the reality of medicine practice. For example, the stomach meridian of the foot Yang Ming and large intestine meridian of hand Yang Ming both belong to Yang Ming. They have more qi and more blood, physiologically speaking. So there are more positives in terms of pathological symptoms. In terms of their treatment method, it's possible to use acupoints found along the surface of the abdomen, and it's possible to use deep needling. American scientists have done experiments, two groups of mice with one mouse eating a lot, exceeding 100% of its total daily capacity, and another group eating 70 to 80% of their capacity. It was found that the mice eating excessive amounts of food died within 3 months, while the mice eating 70 to 80% of capacity were able to live for much longer. So why is it that people who suffer from overnutrition get sick easily? Because the foot Yang Ming stomach meridian and hand Yang Ming large intestine meridian both belong to Yang Ming with much qi and much blood. The stomach and large intestine belong to the organs, and their function is to purify, not to contain. Nowadays, many diseases such as diabetes, cardiovascular disease, and more are born out of food. There's been a long-standing saying in Chinese medicine, eat less and get more stomach qi. Eat more and suffer from karma. The cause is determined by the nature of the intention. In order to explain the occurrence and manifestation of diseases, TCM also has a systematic and complete etiology. However, the etiology of TCM is very different from that of Western medicine. For Western medicine, various causes, especially external material causes, even physical, chemical, or biological factors, exist independently and objectively, either do or do not cause disease. It is possible to conduct independent research, analyze structure, test role, and so on and so on. However, as far as TCM is concerned, it's impossible to study the cause in this way. In particular, the evils of the exogenous 6 evils of wind, cold, heat, dampness, dryness, and fire are inseparable from disease symptoms, syndromes. Independently studying physical wind, cold, heat, dampness, dryness, and fire as existing elements of nature is not useful in terms of quantifying their effect on the body during pathogenic invasion leading to disease. If such characteristics are separated from the patient, their objective existence has basically nothing to do with medicine, and the research results are no longer medical notions. Why is it like this? Because the etiology of TCM is summarized after the examination and verification, according to the disease presentation and then categorized according to its associated analogical definition. A patient with cold syndrome is not necessarily really stimulated by cold. Wind system is definitely not caused by pure wind. It's only because cold and wind act as representative conditions which may affect the body that they're used as metaphors. According to Chinese medicine, the result of complex biological and even social, psychological processes cannot be simply reduced to the results of physical factors. Conversely, if you're really stimulated by wind and rain, wind syndrome, cold syndrome, and heat syndrome and other disease syndromes may not appear. It doesn't make much sense to look at wind, cold, heat, and dampness in their material manifestations alone. It only takes on value when connected to the genuine experiences of human beings undergoing the experience of illness. Just because the etiology of TCM is not a simple external factor but contains special connotations, the etiology of TCM is not the same as that of Western medicine. For Western medicine, material causes, whether physical, chemical, or biological, will not be transformed into each other due to internal reasons. For example, viruses will not become bacteria because of ineffective treatment, and bacteria will not become pathogens for no reason, and so on. But Chinese medicine practitioners, recognizing that feeling cold, evil, and depression for a long time can induce heat, and heat can generate wind. Wind flourishing can induce dryness, and dryness can damage yin. Then after heat, wind, dryness, and yin are already present and removed through treatment, the initial treatment of cold pathogens will have totally lost its significance. And medication can no longer target the original cold pathogen. The particularity of etiology of TCM can be couched in these understandings and should be mainly derived from traditional analogy through clinical science. It has an empirical connection with the objective and natural factors such as wind, cold, heat, and dampness. Real case. I had just come to Toronto to open a clinic in 1998. On the first day, I received an old man who spoke only Cantonese. He had dry stool for 3 to 4 days caused by yin and blood deficiency. This resulted in the inability of the fluid aspect of his metabolism to be able to carry out normal functions of bowel movement, which meant that he was constipated. In such cases, a clinician should know to prescribe to nourish the yin and nourish the blood before purging. And they can use the Zhengye Chengqi decoction. This kind of treatment is called Zengshui Xingzhou. Open and divergent wisdom and inspiration. The theory of TCM is not based on empirical evidence, as in the case with Western medicine, but it's derived from clinical experience based on TCM philosophy. On the whole, TCM theories are intelligent, enlightening, and guiding. The understanding and application of TCM theories often relies on illogical experience rather than logical rules of knowledge. Propositions such as wind gives rise to all diseases are caused by phlegm, all diseases are born of qi, and so on, are all logical judgments, but they're not absolute. Therefore, clinical diagnosis and treatment cannot be understood in this way. Treatment of wind, phlegm, and qi obviously cannot be effective for all diseases. In TCM theory, concepts related to human life are prominent, such as the classification of the 3 central substrates in the theory of medicine, the relationship between the 7 emotions, and the relationship of the monarch and minister in the theory of prescriptions. They use traditional Chinese interpersonal relationships as a metaphor for drug relationships, not the objective and true material relationship between drugs. It is possible to help understanding, but it's impossible to find the high and low and the subordination relationship between drugs. This is only an external category made in a humanistic form, not an internal disclosure of objective objects. The two belong to different fields and cannot be replaced by one another. For example, in the treatment of laws and regulations, adding water and sailing, turning the boat against the current, lifting the pot and uncovering the lid, cultivating the earth to produce gold, and replenishing the mother and reducing the child, are all conclusions of external analogies, which can be used to inspire thinking, help solve problems, and stimulate creative thinking. It can be considered that TCM theory is a divergent wisdom theory that is not restricted by formal logic, rather than a logically strict theory of knowledge. This is one of the differences from Western medicine, and it's not easy to grasp without great study, thought, and practical experience. Imagery, concepts, intuitive judgment, and analogical reasoning. Any theory that has inherent logical structures of thinking, any theory has its own inherent logical structure of thinking. Without this structure, any theory will lose its function of performance and therefore cannot be used to understand the world. TCM has a complete and systematic theory and is used to explain various problems in medicine. However, through its colorful use of concepts, you'll find that its internal logic and thought processes have many unique characteristics. First of all, at the conceptual level, the concepts of TCM are mostly based on imagery. The most obvious thing is that the concept of TCM is supported by the characteristics of objects, such as yin and yang, which are related to cold and heat, dry and wet, high and low, inside and outside, dark and bright. The 5 elements are related to the elements of wood, water, fire, earth, metal, and so on, and are all connected, while the air is connected with the image of wind, cloud, and fog. Many concepts of TCM can be understood by people based on life experience. Very complex medical principles can often be related to patients with descriptions which appeal to their intuitive and vivid life experiences. This is difficult for Western medicine to do, and it's also the advantage of TCM clinics to communicate with patients. For example, when I receive a patient for the first time in clinic, it usually takes 3 to 5 minutes to clearly explain to the patient in concise language about the function and treatment principles of acupuncture meridians. I personally think that treatment is a matter for both doctor and patient. Patients should be made aware of what our doctors are doing and what effects are expected to be achieved so that the patient's cooperation can be obtained and the treatment is beneficial. If a patient comes and their tongue is fat and it has tooth marks, which indicates that there's damp evil in the body, it can be easily explained as if you were to put biscuits in a bottle of water, the biscuits will become larger because the biscuits absorb water. Too much water in your body will make it wet and heavy. And because the tongue is larger due to being damp, then it is easily touched by the teeth and teeth marks appear in the tongue. So this is the typical manifestation of damp diarrhea in the body. The patient will understand this explanation. Second, in fact, at the level of judgment, the judgments of TCM are often intuitive. The logical basis for their judgment contradictions does not overlap. And in TCM, there are times when specialized judgments must be made on anomalous events. There's not enough theoretical and logical basis to answer problems brought up by freak events, only experience and intuition. In addition, by way of example, the xia he, or lower C points in the meridian, are invoked because clinical experience tells us that the function of these acupoints is the main treatment of large intestine diseases. It should be the function of the large intestine meridian and acupoints of Shouyangming and Chucher clinically, yet it mainly treats fever and allergies. By the time the concept had been formalized into practice, the 12 meridians were already defined such that it would not have been easy to redesign their orientation. The theoretical creation of a lower C point could serve as a means by which to adjust for the new discovery of a clinically significant acupoint. As for how to move from hand to foot, the ancients didn't know, nor did it seem that far-fetched to formulate a route, and even develop a relatively simple scientific research spirit while couching the situation according to the experience of clinical events, and leave any corrections up to future researchers. Third, looking further at the level of reasoning, most of the thinking process of TCM is analogous reasoning. For example, the 5 elements in the sky transform into the 5 qi to produce water and fire to dry up dampness and wind. The 5 internal organs transform the 5 ambitions to produce happiness, anger, sorrow, and fear. There is always a surplus of yang, but not enough yin. The other is born from the sun, just like the flowers and the trees. And it's necessary to help the yang and suppress the yin to cure diseases, and so on. These are all analogies and can be scaled from the heavens to the earth, to the sun, to the moon, to people. Analogical reasoning can be formed only by finding the same or similar points between objects. Therefore, in TCM, there will always be substitutions, such as from heaven, earth, sun, moon, and people. However, 2 opposite results can be introduced, namely rescuing the yang and warming the center, and cooling the yin and nourishing yin. This is rarely seen in Western medicine, and it's also difficult for Western medicine practitioners to accept. In addition to its unique theoretical system, TCM also has a wealth of treatment methods that are the main technical content. One is diagnostic technology, the other is therapeutic technology. Its diagnostic techniques can be separated into contents such as observation, smell, inquiry, and palpation, and dialectic analysis, while the content of treatment techniques is more abundant, such as formula technique, pharmaceutical technique, acupuncture technique, massage technique, restoration and fixation technique, and so on. If operational content is improperly mastered and applied, even if the theoretical understanding is correct, the ideal practical effects will not be received by the patient. Because Chinese medicine is a science that closely combines knowledge and technology, books are the carrier of knowledge, and the tutor and teacher are the carrier of technique. It has its own unique features in the operating system of traditional Chinese medicine technology. Personalization and diagnosis and treatment activities. In the practice of TCM, its technical operations always show individual characteristics, whether in diagnosis or treatment. For example, in diagnosis, although there are clear descriptions in the theoretical regulations of the four diagnostics, to look at the complexion, tongue quality, and tongue coating are all objectively existent and are the same for any doctor. But not every individual shares the same pulse condition. Pulse shape and main disease have clear instructions, but not every doctor can realize it in the same way. This requires profound experience. As for acupuncture points, acupuncture techniques, and depth of acupuncture, not every doctor can achieve the same results. Ancient physicians also had profound experience of this characteristic, which were summed up in sayings like, the doctor is defined by the mind, the prescription is the method of imitation of the situation. Even pulse diagnosis clearly points out, these all show that the technology of TCM mostly emphasizes individualization rather than universal technology. Therefore, to truly master practical methods of diagnosis and treatment, in addition to working hard on your own, you should know the experience of the ancients who said, if you're not a third-generation Chinese medicine doctor, don't take your own medicine. This is a great significance to this kind of personalized technology. Flexibility of technical operations. Individualized technique can often reach a very high level and can also achieve unexpected results, but it's difficult to formulate finely determined operating standards that people can follow uniformly. For example, in the diagnosis of TCM, for half a century we've been pursuing the objectification of the four diagnostics. But until now, there's been no operating standard that can be universally recognized and applied. There are many examples of this, such as whether the complexion is red, white, yellow, or black, whether the tongue color is light, crimson, red, or purple, and these can't be determined by colorimetry. The floating, sinking, slippery, astringent, cord, and tightness of pulse condition are described in shape, but no definite standard has been developed. Civil fire and martial fire operation methods are stipulated during decoction, but there's no standard for temperature and time. There are requirements for burning ash storage when processing drugs, but there's no accurate standard of observation and so on. Although there are clear requirements, it does not emphasize precise operating standards, especially when formulating prescriptions. Although TCM has regulation based on evidence, the rules of the legal system and the requirements of monarchs and ministers when preparing prescriptions, different doctors do not necessarily prescribe exactly the same prescription for the same patient. Diagnosis factors such as appearance, presentation, pulse, and so on, they're all physiologically different between different people, and no two people are completely the same. Therefore, it's difficult to establish strict normal standards when determining the disease color and pulse. As a reference, doctors must vary from place to place and person to person and time to time, so the objective study of the four diagnostics is difficult. In the technical operation of TCM, similar situations can be seen everywhere. Although people have been pursuing dialectical standardization, symptom objectification, and diagnostic standardization for decades, it seems that they're still far away from this goal. Some forced standardization practices have been applied, but the result seems to be farther away from the real situation, which clearly reflects the requirement of an inherent flexibility in the technical operation of Chinese medicine. Emphasizing the integration of technology. The TCM system emphasizes integration, not differentiation. As far as the TCM system is concerned, it's always been in a state of integration of medicine and nursing. TCM practitioners not only undertake the task of diagnosis and treatment, but also take care of nursing and guidance, especially with regard to drug issues. For Western medicine, this is an independent academic discipline, and it's generally difficult for doctors to concurrently take up the role of doctors who simultaneously act as pharmacists. However, as far as TCM practitioners are concerned, TCM has always been inseparable from pharmacy. TCM is not only responsible for administering medicines, but also for collecting medicines, preparing them, formulating them, and cultivating them. In the history of TCM, almost every medicine book was edited by doctors. There are very few medical scientists who are also pharmacists, and few people are able to simultaneously practice medicine and formulate Western medicine from the conceptual basis up. Moreover, in terms of medical equipment, sharing is also emphasized, and there are not too many pieces of professional equipment. For example, the cupping cup, the medicine pot, and the decoction pot, the splint for fixing fractures, and so on, can all be replaced with daily necessities. In addition, in terms of diagnosis and treatment methods, apart from acupuncture, massage, orthopedic restoration and fixation, and surgical excision, the four diagnostic methods are basically the same, and there are a few different diagnostic indicators for each department. Free and flexible technique. Practical techniques of TCM are produced and invented under the stimulation of practice. There's no clear theory to guide the invention before the invention is made, nor is it designed based on theoretical principles. After the technique is applied, the theory must be made relative to the function of the technique, and therefore is inherent in nature. The explanation does not carry out additional theoretical research on the nature of the technology. For example, multiple effective prescriptions are not created under certain theoretical constraints, nor can they necessarily be substituted for fixed prescriptions. So the treatment cannot be theoretically stated. Proceeding from this principle determines strict regulations on the type, quantity, and dosage of drugs. Technology does not rely on constructive knowledge. The technical content of TCM is not based on structural theory, so the technology does not require redundant structural proofs. What TCM describes is a whole that is transformed from one energy, and this organic whole cannot be decomposed. Therefore, TCM does not understand the human body from a structural perspective. This means that when the technology of TCM is applied to the human body, it does not depend on the study of anatomy to operate. Palpation, adjusting the bones, recognition of signs, and so on are closely related to understanding of trends in the body, not following the immutable characteristics of anatomical form. Modern scientific and technological activities must undergo anticipated experiments in order to seek the relationship between variables, eliminate errors caused by accidental factors, and reveal the essence of laws. Only such a technology can become a social technology. It is no longer in the domain of individual knowledge and can be widely replicated and may be used according to the basis of the preset experimental process. There's no way to know how much TCM knowledge has already disappeared within the annals of folk history and which aspects of Chinese medicine were not passed down more commonly throughout society. So much so that in the history of TCM, there's been a fairly common consensus that you may know what's happening, but you may not know why. And sometimes things can only be unspeakable in nature. And secrets that were not passed down through the ages are the inevitable result of outstanding experimental technology. In summary, we reviewed the origins and development of Chinese and Western medicine and their academic characteristics. Because of the differences in historical origin, development, philosophical basis, cognitive paths, and behavioral rules, each has formed huge systems. The development trajectory of each medicine is different and has its own national brand. Western medicine is another medical culture model different from TCM. There are major differences between the conceptual system, the theoretical system, and the technical system. Due to the complexity of historical and cultural reasons, the theoretical system of TCM has gone beyond the limits of Western morphology and anatomy, and has embarked on another direction of understanding, summarizing, another type of functional theory. The holistic view and dialectical treatment model, this will eventually bring difficulties in empirical research on the theories of TCM. This is a major scientific and cultural mystery in the history of medicine, and it still puzzles the TCM community in regard to the ongoing difficulty of communication with Western medicine. Thanks for watching.